Before we start today's episode, I would like to quickly read you our podcast disclaimer. The content in this podcast is for general reference and educational purposes only. It is not meant to be complete or exhaustive or to be applicable to any specific individual's medical condition. No information provided in this podcast constitutes medical advice and is not an attempt to practice medicine or to provide specific medical advice, diagnosis, or treatment. This podcast does not create a physician-patient relationship and is not a substitute for professional medical advice, diagnosis, or treatment. Please do not rely on this podcast for emergency medical treatment. Remember that everyone is different, so make sure you consult your own healthcare professional before seeking any new treatment and before you alter, suspend, or initiate a new change in your routine. Welcome to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets,
two internal medicine doctors who spent years practicing traditional primary care. Over time, we realized something was missing from modern healthcare. A real understanding of how everyday lifestyle choices impact overall health.
We'll help you cut through the noise of the countless health influencers and their conflicting opinions, because no matter who you follow, the basics of lifestyle medicine are at the heart of it all.
Welcome back to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets.
Hopefully, you've been learning some things about aches and pains these last 3 weeks.
We're really excited to continue our musculoskeletal series. We talked about knee pain, which is something that's very common for people to experience in their lifetime, as well as back pain. But we wanted to change this week and go over inflammatory arthritis and some autoimmune conditions, as well as fibromyalgia, because these impact people's lives tremendously and sometimes are really challenging to manage, as well as finding someone that you feel confident in addressing you as a whole person. And that's really the purpose of this podcast this week. So we're very excited for our guests.
We are. We have Dr. Olga Pinkston with us today, and she is a rheumatologist in Louisville, Kentucky. This is also our first remote recording. So thank you for doing this with us. Dr. Pinkston is one of the most knowledgeable people on this subject you could even have talk with us. She is the owner of Whole Health Rheumatology, and not only is she a board-certified rheumatologist, but she is also board-certified in lifestyle medicine. She has additional training in trauma processing, as well as CBT, cognitive behavioral therapy for chronic pain, anxiety, and depression. And if that wasn't enough, she's currently doing an integrative medicine fellowship. So she has a wealth of knowledge to share with us today. And she actually has her own very successful podcast called Mind Your Fibros. So definitely check that out for more information as well. But Dr. Pinkston, thank you so much for being here with us today.
Oh, thank you so much for inviting me, Dr. Dotson, Dr. Schutz. I am so glad to be here, and I hope we'll have a very productive conversation. I think lifestyle medicine and integrative medicine and whole health approach to any disease is so important. And I'm so glad that you have a podcast focusing on this topic.
Can you tell us a little bit about how you even got into rheumatology and then went down these other roads of learning more about other avenues?
I actually came from Soviet Union in 1992. I lived in Uzbekistan, which is part of the Soviet states. And in 92, my family immigrated as refugees. My mother was a physician, family medicine, primary care in Soviet Union. And my paternal grandmother was a pulmonologist. So I was always surrounded by medicine and medical field, and Russians really use quite a bit of alternative complementary medicine. The healthcare was not as advanced in the 80s and the 90s. I'm still using some of the remedies. The tea we drink when we're cold. I have a recipe on Facebook, some raspberries and honey and lemon. So we always used more than just medications as I was growing up. When I came to US, I was a pre-med, but I had to go to high school and I had to learn English and I had to decide what to do. And I ended up actually doing engineering instead of medical school because I thought there was no way an immigrant who doesn't speak English can get into medical school because it's so competitive. I worked as a computer engineer for about 8 years, and finally my job got outsourced to India. And that was my a signal, okay, this is a sign I have to go and do something different, and you have to do what makes you happy. Medicine never left my mind since I was 6 years old. This is what I wanted to do. So I went to UofL Medical School, really thinking I want to do the primary care because I want to be the primary care that I remember my mother being, having time with patients, telling them about remedies and drink your tea. Through medical school, I started seeing more complex conditions because we get more exposure as medical students into inpatient world. So I said, I really want to do more complex conditions. And I applied to internal medicine residency. And every year in residency, my intern year, second and third year, I had a very complex lupus patient. I had the opportunity to rotate through rheumatology with Dr. Ronika Rowanel at the VA. And in 2 weeks, she told me, Olga, you want to do rheumatology. You should do rheumatology. You should be a rheumatologist. Did I tell you should be a rheumatologist? I've had 3 young children, and my husband, he's from Louisville. He had a job in Louisville. And I came home and said, what do you think about me going for fellowship in rheumatology? And it was a joint decision. It was a difficult decision. And I ended up interviewing at a small program in Jacksonville, Florida at the Mayo Clinic. So when I went to Mayo Clinic, it was the first opportunity to really experience healthcare in rheumatology, but outside of Kentucky. And my mind was blown because for the first time, I saw patients who were really healthy in terms of lifestyle, eating better, looking at holistic ways of improve their health, and having physicians who are trained in not just their specialty, but also there's a department of lifestyle medicine, there's a department of integrative medicine, there's a whole department of fibromyalgia education and treatment. I knew it was the right decision, and it's just the end is history.
You actually had a big impact on me. And even when Sarah and I were first talking about possibly starting this podcast and would we want to have other doctors on, I was already thinking about you. I think I told
No,
you. I
you
was like, I
did.
was
You
already
did.
was like, I want to have Dr. Pinkston from Louisville on because you made a big impression on me, which I'm sure you had no idea. But we had a mutual patient when I was practicing in Louisville, and I sent her to you. She was a very complex patient, and you really just approached her differently. She'd seen lots of specialists, and you really approached her from, looking back on it now, a lifestyle medicine standpoint. And you looked at her nutrition, you looked at her sleep, you looked at her stress. And it was so interesting to me because, particularly the nutrition portion, she was someone I was trying to get to lose weight. And you sent me a message personally after you'd seen her. And you said, this patient is malnourished. And although we need to address her rheumatologic issues, she is not going to get better until we can improve her nutrition, we can improve her sleep, we can improve her management of stress. And I was like, this is it. This is what we need to be doing for everyone. This is how we need to be approaching patients. And it just really opened my eyes. And that was before I'd heard of lifestyle medicine, but that's what you were doing.
When I was at Mayo Clinic, they have the longest run worldwide fibromyalgia care program. And it's a 3-week program it's like inpatient, outpatient, when patients go in and they go from 8 o'clock in the morning until 5 for 3 weeks. And I asked that program to be my elective. So I sat with patients for 3 weeks as a patient, taking all the classes, going through all the activities. And for the first time, I was really exposed to multidisciplinary approach to pain. And they had lectures on nutrition and cognitive behavior therapy, physical therapy, weaning off pain medications, opiates, and whatnot. And for me, I saw patients who walked in with walkers and 3 weeks later were walking out on their own. It was such an impact on me as a physician. This is the program that does not use medications and patients doing better versus we're prescribing meds upon meds for every symptom and then every complication, every side effect. So the approach that they use for addressing stress and trauma and cognitive behavior therapy and what we eat matters and how much we move matters, how much we don't move matters. And with fibromyalgia patients, especially, movement is stressful because movement causes pain. So addressing, yes, you will be in pain as you start moving, but you need to learn how to pace yourself and not push and crash. And yes, sugar is toxic to the nerves and toxic to your brain and toxic to your well-being. That kind of started me really looking at how can I integrate that into my practice, because patients come in and they have often just general complaint, I don't feel good. And we hope to find an answer or a diagnosis. It's easier for a physician to have a named diagnosis and a treatment and a pill or shot.
Oh, yeah, definitely.
But if we don't, they still don't feel good. And we still haven't solved the problem of why they came into the office. I don't feel good. Why? Are you tired? I'm exhausted. Why? Are you in pain? I'm in pain. Why? And it's not just naming, oh, you have inflammatory arthritis, is you have inflammatory arthritis, and this is maybe the last symptom that you had for 10, 15 years before. First, you had trauma as a child, and now we know that trauma converts into stress and how we manage stress and affects our immune system and nervous system. Now, maybe in your 20s, you're too busy working and going to college, and then you get too busy with children. And then finally, in your 40s, all your resources are gone, and now you have an autoimmune condition. But it was being developed over time through lack of nutrition, picking up chicken nuggets after your children. I've done it.
Oh, yeah.
Sleep deprivation. I've done it. Not drinking enough water. Gosh, sometimes I forget to drink the whole day because I'm busy between patients. And as doctors, we learn, eat when you can, pee when you can. That is our lifestyle, but it leads to disease. And then we can't just say, okay, now you have autoimmune condition, rheumatoid arthritis, take this pill, and not address all these years of self-neglect and lack of self-compassion. And this is what I see the most in my patients, who are mostly women. They're too busy caring for somebody else. They're caregivers. And caregivers have a higher incidence of autoimmune conditions because not only they care for everybody else first, they also lack a lot of self-care. And it becomes very complex.
Can you just give our listeners an overall short synopsis of what is an inflammatory arthritis versus an osteoarthritis that they may be more familiar with?
So when I look at the patient who comes into my office, ironically, I still kind of run the algorithm in my head as a programmer, deciding in what pathway they fall in, because sometimes patients can actually have multiple types of pain. And they may have wear and tear arthritis at the same time as they have rheumatoid arthritis, at the same time as they have neuropathy due to diabetes or back pain, at the same time as they have fibromyalgia. So just because they have pain, it's very important to tease out what joints hurt when, why, and how. And really, physical exam and listening to a patient is extremely important in rheumatology. When we're looking at a patient from a rheumatologic point of view, we're looking at the difference between mechanical pain, which is wear and tear arthritis, joints are rubbing together, creating friction, the walk, the hurt, the squat, the hurt, the stand, the hurt, because it's gravity, it's use of joints. So that's more mechanical pain. So we're looking at questions like, when do you hurt? If walking into the grocery store makes your pain worse, maybe that's more mechanical pain versus rheumatologic pain or inflammatory pain will be more with swelling from inflammation. So do you swell, and what joints swell? And our bodies are amazing. We have so many patterns of arthritis that we can just evaluate from location point of view. Rheumatoid arthritis really likes symmetrical small joints. Wrists, the larger knuckles, the middle knuckles of the fingers, they swell, they hurt, and they may swell and hurt more in the morning and have the stiffness feeling. And that stiffness and swelling may improve through the day. And people tell me, I feel like I have peanut butter in my joints. They feel stiff and achy and very puffy or very swollen. But as I move through the day, or if I take anti-inflammatory medication like ibuprofen, I feel better. So movement actually makes people feel better very often if they have inflammatory type pain versus mechanical. And then pain with psoriatic arthritis, for example, may like more distal knuckle close to the nails. Also, we see nail psoriasis. And psoriasis can really affect many joints in different patterns, but it's often not as symmetrical as rheumatoid. Rheumatoid likes hands and feet. And people tell me, I wake up in the morning, I feel like I'm walking on rocks. My feet are very tender, they're still swollen. And mechanical pain, say, I feel a little stiff, maybe 5-10 minutes in the morning, I stretch, I feel better. But then the more I do, the more I hurt. Again, patterns of pain and physical exam is very important. And imaging and labs, you have to start with this, listening to the patient and hearing the story to tease out types of pain.
And I think it's sometimes hard for patients to know how to advocate for themselves or who to see when they're having pain. What is something that should make someone think, maybe I need a rheumatologist to help tease out what might be going on?
A lot of patients have pain, and especially women. And women tend to downplay their symptoms because I'm tired and I'm in pain because I'm a mom. I don't eat, I don't drink, I don't sleep. And then I have aches and pains. But if your pain doesn't go away or gets worse and you find yourself reaching for ibuprofen more days than not, or you can't explain your pain really well, It's not just overuse. If pain wakes you up from sleep, especially if you're female, less than 40 years of age, if you have pain in the joints of the spine, of the hips, it may be a sign that it's not just wear and tear arthritis because you may be younger than somebody who should have that pain in the spine. Again, teasing out the symptoms and teasing out the location and duration of symptoms. And of course, starting with primary care physician and saying, hey, this is not normal for me. This pain has been too long and I just don't know why I have this so much pain. Starting there, I think would be useful.
Yeah, I think that's where you have to start because usually to get into a rheumatologist, you need to have a reason because there are so many people needing to get in that you really do need to start with your primary care first because they're probably going to have to get that referral to get you in to be seen. And there's a lot of testing that they can do that can already be done.
In primary care, it's really helpful when a patient comes that is having new pain and they're able to tell a good history. So I think that's something that is very valuable for any of our listeners is if you feel like you're struggling understanding where your pain's coming from, etc. Even if you're taking time to journal, like when do you experience it? How long does it last? All these things that you just mentioned that is typical for an inflammatory arthritis. If you're able to articulate that better to your doctor, it helps with starting that workup as well.
Sometimes I see patients, especially in my new clinic, because I don't require a referral. Patients come with what we call non-specific complaints. They don't feel good and they have pain, but they don't know why. And oftentimes they had testing and everything is normal. Just because the labs are normal doesn't mean you're not in pain. And unfortunately, in our healthcare system, patients get gaslighted all the time in terms of your pain must be not real if you have normal labs. And it's not really true because, again, there's so many different types of arthritis and types of pain. Not every inflammatory arthritis will have abnormal labs. It's detail, it's physical exam, and it's really interviewing the patient. My new patient appointments last for a reason between an hour and a half to 2 hours because I have to tease out, is it lifestyle causes of the pain? Is it inflammation? Is it the labs were not done properly or when were they done? So reviewing a lot of data, but they're really putting a patient in the center of the story and just giving the time and listening why and when they hurt and figuring out what is the root cause.
And speaking of labs, because I do think in this field in particular,
Mhm.
we are very heavily reliant on positive lab work to confirm that diagnosis. If someone has had a workup that's been negative, but they're still concerned that they may have an autoimmune condition, what do you recommend to them to try to do?
See a rheumatologist because even the labs are normal, the physical exam or the imaging may be not normal. And also just again, pattern of pain. But some labs can be abnormal also, and they don't have a medical condition to support it. We have extremely sensitive labs nowadays because technology improves so much. So we see false positive results very often. One of the most common consults we see in rheumatology is the positive ANA. And we see the patient with positive ANA, often they Googled it already and they put in the positive test and some of their symptoms, and they're convinced they may have lupus or SLE. And teasing out, again, the pattern of complaints and the physical exam and the lab work together points to the diagnosis of lupus, not the labs. We use labs in rheumatology very often to confirm the diagnosis or our suspicion, not to screen for the diagnosis. And unfortunately, because of shortage of rheumatologists, we use labs to screen for lupus, which is not the way to do it. I may not often order lupus labs if my clinical suspicion and the symptoms are pointing into a different condition. But in a primary care, our order sets may include screening for many autoimmune conditions, lupus, rheumatoid arthritis. And if they come back positive, the patient is stuck with positive result and stress while they're waiting for rheumatologists to see them. And often they feel lupus is what they have. It's a very hard condition to live with while you wait for rheumatologists, because if you look back in the history, it's a severe autoimmune condition that can be deadly. But up to 25% of positive ANAs or positive ANA labs are false positive, meaning they're positive, but there's no lupus that is triggering the result. One of the most common causes of positive ANA is thyroid condition. So there are more women who have low thyroid function or hypothyroidism or hyperthyroidism that can turn that ANA into being positive without the autoimmune condition. You need to have a rheumatologist to really tease out if it's a result that's positive for a reason or just because it was screened.
So if you have a positive ANA, you may have an autoimmune condition, but you may also not. And then vice versa. If you're having symptoms of an inflammatory condition, you may have positive labs and you may not. So it's really finding someone to go through everything with you, listen, and then relate all of that is what you need to make sure that you're doing if this is a concern that you might have something like this going
And the
on.
value of having a rheumatologist to be able to, once these screening things done, to look at the whole picture and be able to come up with the correct diagnosis. Because I know many patients who have autoimmune conditions, it takes them a very long time to actually get the right diagnosis in general. And so that is the value of having someone that's trusted in the field to help you tease that out.
And can you briefly tell us also what fibromyalgia is and how that's a little bit different than some of the other inflammatory arthritis?
Well, fibromyalgia is a very old diagnosis. And unfortunately, because of the history, how it has changed name through the decades or centuries, there's a lot of mistrust in the community among many physicians as well as patients. And many people believe that fibromyalgia is not real. And I can tell you, as a rheumatologist who has seen many patients with fibromyalgia, fibromyalgia is a real diagnosis, it is a real medical condition. In fact, any painful condition, any pain that patient experiences, regardless of the cause, is real. So fibromyalgia, just like any other painful condition, is a condition where the pain is processed in the brain because our organs, our joints, our skin does not have the processing ability to distinguish pain or process pain. So fibromyalgia is a complex medical condition that affects millions of people worldwide. It causes widespread pain or pain all over, along with other symptoms that can significantly impact a patient's daily life. Fibromyalgia as a diagnosis is a chronic or long-lasting condition that causes pain all over the body. It's like the body's pain volume knob is turned up too high. Pain is amplified. It is not a diagnosis of exclusion. Patients can have multiple times of pain at the same time. Patients may have rheumatoid arthritis. They may have also chronic back pain. They may have neuropathy from diabetes and also can have fibromyalgia. So it used to be that we don't know what's wrong with you if you might have fibromyalgia. Now we know that many painful conditions can coexist. People with fibromyalgia might feel pain even where there should not be any pain, meaning they had an injury, the injury has healed, but the pain persisted. Besides the pain that people often describe as widespread pain all over, patients tell me, I feel like somebody beat me up with a bat, or I have the flu, my hair hurts, my skin hurts, my muscles hurt, my joints hurt. The pain comes on often at random, and I see a lot of association between stress and onset of a fibro flare. But along with pain, patients have other experiences that often include extreme tiredness, fatigue, exhaustion that does not improve with the rest, sleep problems, trouble with concentration, brain fog, mood changes, anxiety, depression, headaches, joint pain, jaw pain, digestive problems, bloating, constipation, sensitivity to lights, sounds, temperature, smells, touch. Many patients tell me even a hug will hurt me. So, what causes the fibromyalgia is still unknown, but research is ongoing. There's no currently valid test or imaging study to diagnose it. So we have to really rely on a patient's story and a patient experience and physical exam to come up with this diagnosis. Now, there's another term that's often used describing fibromyalgia. It's called central sensitization, is central nervous system being sensitized or sensitive to stimuli. And central sensitization happens when your central nervous system, your brain and spinal cord, becomes overly sensitive to signals. It can be pain signal, stress signal, touch, or other inputs like smell or sound. Imagine your nervous system as a home security system. in a properly working system, small disturbances like a branch touching a window or a wind slapping against your front door is not going to trigger an alarm to go off in your home. But if there's a central sensitization, even small triggers set off the whole alarm system. So all those real signals may amplify, and even non-painful signals that may be interpreted as painful, or some signals that are sensory may be more obnoxious than it should be. So the brain becomes more efficient in detecting pain, leading to increased sensitivity over time and leading to kind of abnormal processing. So when we see patients with fibromyalgia, they're sensitive to many inputs. Central sensitization syndrome is a broader term that includes fibromyalgia and several other related conditions that share the same problem of an overly sensitive central nervous system. And these conditions include irritable bowel syndrome, IBS, chronic fatigue syndrome, tension headaches, migraines, TMJ or temporomandibular joint disorders, painful bladder condition called interstitial cystitis. So many patients with fibromyalgia may also have those conditions, along with anxiety, depression, poor sleep, and other symptoms. Sensory overload, and many patients with fibromyalgia find that bright lights, loud noises, strong smells can be overwhelming and even trigger some flares. Even some positive experiences like a birthday party that maybe somebody is looking forward to attend may cause a flare because it's overstimulating the nervous system. We have to really be mindful and patient because patients with fibromyalgia and many other rheumatologic conditions really not only get stigmatized, they take years to get diagnosed. They get passed from one specialist to another. They may have a GI specialist for IBS, rheumatologist for rheumatoid arthritis, neurologist for migraines, psychiatrist for anxiety, depression. But all those conditions overlap and often feed one into another. So if you have a lot of anxiety, taking medication, and somebody prescribes you new medication for joint disease or for a migraine, it may trigger your nervous system to be overly protective or overly vigilant because, again, our nervous system has experiences of trauma, has experiences of processing those stimuli over and over from different providers, from different physicians, from different healthcare systems. And really having a trauma-informed care is really essential for those patients. When patients with fibromyalgia get diagnosed, we do have to rule out other medical conditions like arthritis or thyroid problems. I also often see patients who may need nutrition evaluation. Multiple vitamin deficiencies can really mimic fibromyalgia. I also see fibromyalgia symptoms in perimenopause. So on my differential for somebody who is in their 30s, 40s, 50s with the symptoms of fibromyalgia, I will also screen them for perimenopause and hormonal issues that are often ignored for years in patients who may have still regular periods. And really, we think they should not be in perimenopause or menopause. As every pain condition, fibromyalgia is not simple, and it has to be on differential for somebody who has chronic pain and really requires a careful examination, history taking, patients, significant trauma-informed care.
That is a great summary of just the difference between fibromyalgia as well as inflammatory arthritis from our typical osteoarthritis. When I was learning a lot about lifestyle medicine, what really blew my mind, and I felt like it was just not taught well in medical school, was the impact of lifestyle changes for these specific conditions that you see in rheumatology. We would really like to talk about some of the pillars of lifestyle medicine and the impacts that autoimmune conditions can have, as well as fibromyalgia can have with each of them. And of course, our first bucket we always like to talk about is nutrition. Can you tell our listeners the impact nutrition can have on these conditions and that you've seen with your patients specifically?
I think nutrition and what we eat is so important. And in lifestyle medicine, we use food as medicine concept. Before we start adding medications, we have to look at our diet or what we eat to see, are we eating what's beneficial for us or not? So when I look at patients with any medical condition, doesn't matter if it's rheumatoid arthritis, lupus, fibromyalgia, or diabetes or high blood pressure, we'll have to look at what we eat and what we don't eat. In terms of nutrition, I have seen many patients who may be malnourished. meaning they consume calories and they may be even overweight or have normal weight, but they're actually nutritionally depleted. And those often are busy moms who may be in their 30s, 40s, running around with the children. Maybe they're a bit overweight, maybe they're not, but they don't have time either to cook or they don't take time to plan their meals. And over time, they eat low nutrient foods, lots of carbohydrates, lots of processed foods, maybe fast food, and they develop nutritional deficiencies. I have diagnosed scurvy, which is a vitamin C deficiency, by 30 to 40 times a year in patients that you would never assume malnutrition. You
Yeah,
know,
you did that
mild
with one of mine, and I was thinking scurvy. We'd always learned about pirates and sailors having scurvy, and I couldn't believe it. And you were right. You had said from meeting her before you ever did any testing, you said, I think this patient has scurvy. And you were correct.
scurvy was not on my radar until I had a patient who had a non-healing ulcer on the foot. And she was a young woman in her 30s, average built and overall healthy. She had a trauma to her toe and it would not heal. And podiatrist actually ordered a vitamin C level. And I was seeing her for general aches and pains, concerned for autoimmune condition because she didn't heal well and she had joint pain. And when I was doing her workup and I ruled out everything, his labs with low vitamin C came in, were resulted, and it blew my mind that she actually had scurvy. Vitamin C is essential for bone and muscle and joint health. It's part of the cartilage. It's essential for life. Mild deficiency is not going to be as profound as what we see in sailors. You may have bleeding gums, but you may not lose teeth like pirates. But you may have fatigue, you may have dry skin, you may have coarse hair, you may have just general aches or joint pain. You may have rashes. You can Google rashes with scurvy. I have seen multiple women, seen men and women with scurvy, and they're not that impressive at the milder to moderate deficiency. But if you test vitamin C, the levels will be low or non-existent, meaning they did not eat fresh fruits and vegetables probably consistently for months before they were tested. And when I look at the vitamin C level, I also often check vitamin B12 or folate and vitamin D. And those are inexpensive, readily available tests that primary care can use to screen. But if they're all low, what it tells me is if the B12 is low, they don't consume enough protein because B12 comes from eggs and meat and beans and some other protein-rich foods. If they don't have vitamin C, they don't consume enough fresh vegetables. And if they don't have vitamin D, they don't go outside enough, which is what our culture is now, right? We're working all day, we drive through to eat, and we go home, watch TV. And over time, not intentionally, no one intentionally wants to be malnourished, but gradually over time, their deficiencies develop and they produce symptoms such as fatigue, achy joints, brain fog, constipation, and it just becomes a chronic issue. And once you correct them, I had patients who corrected them within 3 months. They stopped drinking soda, started cooking more, started eating fresh vegetables, started taking a multivitamin. And then in 3 months, those lifestyle modifications really paid off and the levels got corrected and they felt so much better. They have less depression, less anxiety. They feel so much better with the fairly inexpensive lifestyle changes we all can do without significant effort or cost.
That's powerful. You feel like you're truly healing someone in that sense, where you could have spent tons of money on expensive tests and workups. And really, it was the basics that the patient needed to begin with to feel well and needed to start there. And that's powerful. Another thing that comes up a lot with autoimmune conditions is the idea of an anti-inflammatory diet. What does that even mean? And what does that do?
I don't like the word diet because I think the word diet implies that you're dieting for a reason. And yes, maybe if you have an autoimmune condition, you need to diet per se for some reason. If you're trying to figure out why you have GI symptoms or maybe try to reduce inflammation. But what I usually recommend people not to get hung up on anti-inflammatory this or what kind of diet you're eating is to look at your nutrition from a holistic point of view. Are you eating things that your grandparents used to eat? Are you cooking your meals? Are you buying vegetables? Are you driving through drive-through? Eliminating processed foods and sugar and soda of any kind, anything that you can drink that you can add with ingredients, if you eliminate them first, before you get all bogged down on details, you will see the huge impact on your health. Some patients may not understand the complexities of different diets, and that's totally okay. Just taking added sugar out of your diet every day and see what that does to you. Removing all the soda out of your diet and see what it does for you. I had patients who consume between 2 cans of soda to 2 liters of soda per day. That's huge amount of processed food and sugars that are clogging our gut and our kidneys and our liver, this junk. So I give an analogy to my patients, which is simple to understand. If you're planting a tomato, and we're going to have tomato season soon. So you pick a really good tomato plant from Lowe's, and you get the best part of your garden, and you get fertilized soil, and you get some plant food, and you get a little fence from the rabbits, and you get some sunshine, and make sure there's no shade, and you water it every day. That is like good diet would look like, right? But if you start coming once a week and pour some wheat gone on it, doesn't matter what you do day in and day out, it doesn't matter. That pesticide will kill the plant or make it look puny and not produce fruit. So before you start buying this organic and supplements, remove the junk. It's the simplest, cheapest way to improve your diet. The studies show that any diet that is not standard American diet, which is burgers, fries, donuts, soda, will benefit you, and then once you have benefit, you may modify it to your preference. Some people may be better eating vegan, more vegetables, and they don't tolerate animal protein. Some people need animal protein. They cannot function without animal protein. Every person should personalize their nutrition to their needs, physical activity, their digestion, their mood, whatever they don't do in terms of lifestyle. But they have to remove the junk first to see the benefit. You cannot have inflammatory diet and continue drinking soda. It's not possible.
I really love the new movement of plant diversity, but have you seen anything where people that have started doing that and trying to improve the gut microbiota have any more benefit given the thought that would promote less inflammation?
I think plants in general make us feel better. The more plant-based meals you eat, the better you're going to feel. Because the fiber that we eat has benefit of feeding the microbiome in our gut, but also make sure we don't have constipation, make sure we don't have diarrhea. But also, when we look at how much we eat in terms of amount of food, especially in the US, our portions, no one ever told me they ate a bushel of apples or they ate 12 zucchinis in a row. It's very hard to do multiple steaks. It's hard because our body is not designed for the amount of food that's whole. But we can easily eat 3 cookies followed by cake and the birthday party and drink some soda. And then 5 minutes later, we're still hungry. You want to eat something else, followed by pizza. Because those processed foods, they don't have the nutritional value that our body is looking for, that is seeking. But if you intentionally add vegetables with every meal and as many snacks as possible, you're going to be set. I'm going to have at least an apple a day for a fruit and as many vegetables as I can. Even just broccoli, it's better than none. But as you expand your palate, you may develop more taste for more vegetables and more different types of vegetables, and you can grow that palate. Not complicated. It may be fun.
So for patients who maybe grew up not eating a lot of fruits and vegetables and don't have that desire to eat them at all, or their palate's not there, when that is not something that they're ready to really expand at this moment, do you ever recommend just doing many of these different green drinks that are out there at this point? Or do you just recommend that someone automatically takes a multivitamin if they aren't able to expand their nutrition up front?
It's very common. When I see patient, I ask for a complex intake form. And the intake form goes all the way from the childhood trauma through symptoms. And I ask a lot of questions about GI symptoms because GI, meaning gastrointestinal symptoms, constipation, diarrhea, are often overlooked in our society. People get used to having constipation and only have a bowel movement once a week or twice a week. And it's not normal, but it's normal for them. So if somebody says, do you have constipation? They might not even think about it because this is such a normal thing for the last 10 years of having a rare bowel movements or frequent diarrhea. And somebody says you have IBS. So if I'm looking at the patient from dietary point of view, I ask them, how is their gut? And then oftentimes our gut dictates our food preferences. If you're eating a lot of sugar, your gut is going to reflect that. You're going to have a microbiome that has a lot of bacteria that prefers to eat sugar, because the other bacteria that prefers to eat broccoli is not going to be there because you don't feed it. If we have an intention to expand our vegetable palette, we can do that. Looking at smoothies and looking at drinks that you can purchase, again, they're processed somewhere else. So I consider them processed foods. They may be a convenient vegetable source. So if I'm on a run or somebody had wisdom teeth surgery, I will give them a juice, but it's not my preference. Most juices and drinks lack fiber, but also it's actually chewing that produce that starts mixing with your saliva. That's when your digestion starts. So when you don't chew your food, you delay that digestion. And again, the whole mechanism has to be fine-tuned. But looking at your symptoms, your preferences, your diarrhea, constipation, the bowel movement pattern, and adjusting your food gradually to make sure it's not overwhelming. Make sure you're not having so much bloating because all of a sudden you start eating so much produce that you feel uncomfortable. Any new habit, it's better if you start gradually and fine-tuning it as you go along.
Yeah, just like we've said many times, don't increase your fiber too quickly or else you may be very uncomfortable. So slowly make changes. You don't have to do everything at once. Just I think your advice of just eliminating the junk first, starting there, and then start incorporating things a little bit at a time. I wanted to jump to talking about movement. You already said that sometimes when you're having pain and dealing with these conditions, movement can cause a flare or can cause things to feel worse. Is there any specific type of movement that you recommend for people?
So I look at each patient individually. So this is why in lifestyle medicine we do prescriptive kind of decision making for each patient to make sure it's individualized. So somebody who's very active obviously will have a different prescription than somebody who doesn't move and majority of the time sits on the couch or sleeps in bed. So somebody who has inflammatory arthritis, if they're in a severe flare, if their disease is not controlled, if they have swelling all over, I tell patients, move, don't sit on the couch, but don't go and exercise in the gym. It's like you have a wound that's inflamed and you don't want to sprinkle salt on it to aggravate it even more. But if you sit too much, you're going to have more stiffness. So having a balance when you move, but don't push too much that you're going to actually inflame your joints further. If you have something swollen, you don't want to increase the swelling. But once your flare or condition is controlled, you want to build your muscles because muscles support joints. So the stronger your muscles, the more mobility you're going to have, the more balance you're going to have, the fewer falls you will have as you age. The stronger muscles actually make our joints feel better. And how do you achieve it will depend on the level of mobility at baseline and what they're willing to do and how much and who can help them with it. So obviously, if somebody has a personal trainer, may have a different path and increases in endurance and mobility than somebody who doesn't have a personal trainer. And for some people, I start with physical therapy because they're so deconditioned and so afraid to move because every time they move, they hurt, which is normal. If I don't walk for 3 months and I go for a walk, I will feel pain in my joints and in my muscles because I will have some almost like a sweeping the corners with cobwebs. I need to like clean up my joints. I need to stretch them a little bit. I need to get them moving, lubricate them. But it's expected. But if you're afraid of pain, that creates a pain fear cycle. The more I hurt, the more I'm afraid to move. The more I move, the more I'm going to hurt. And people get stuck in that. There's a term called kinesiophobia, meaning fear of movement, because if they move and they had pain, and pain is an alarm to our body saying something is wrong, don't do that, and they'll listen to it and believe it, they're going to stop moving. And the longer they don't move, the more pain they're going to have when they start moving again. So having a physical therapy group that you trust and who's not going to push patients, but they need a rehab and they need to start slow. It may be aqua therapy because the water makes them feel not as heavy and it's easier to move in the water, or just walking to sometimes to the mailbox and back. I tell patients, your prescription is walk to the mailbox and back once first day, and then every day increase how many times you can go back and forth. And over time, you may be able to walk down the street and back. And so gradually increasing without crashing, meaning flaring, being afraid, being anxious every time you move. We're practicing not stressful movement that is enjoyable so you can keep doing it for the rest of your life. Don't stress over your diet. Find a way to eat so you can eat that way for the rest of your life. And this is why I don't like the diet part, because diet is in our culture is usually temporary. I want a diet to get in a swimsuit. And the same thing with the mobility. You want to find a way that you enjoy movement every day. And then if you need to, after that, once you're more conditioned, to find a way to build muscle. And for women, weightlifting is very important. Resistance exercises are very important for bone health and muscle building and mobility and balance, especially with osteoporosis. But for all patients, as we age, we lose mobility, balance, and muscle loss is ongoing unless we build muscle every day.
One of the buckets that may be left out in lifestyle medicine the most is sleep, but it's equally as important as the movement and nutrition aspect. What do you typically talk about when you're talking about sleep to patients with autoimmune conditions and the impact on their overall health?
I think sleep is essential for well-being and wellness. Obviously, if we sleep deprived, we're not going to heal as well. We're going to be more irritable. We're going to be more depressed. So I look at sleep just like nutrition. I'm evaluating why the sleep is not as good as the patient wants it to be. Is it sleep apnea or insomnia that is a medical diagnosis? Is it poor sleep hygiene? Do they watch TV in bed? Do they stay up playing video games? Or do they not have a regular sleep schedule? Or do they have pain through the night? A lot of rheumatologic conditions will have joint pain that is worse at night, especially conditions like ankylosing spondylitis or spinal arthropathies. We see it with psoriatic arthritis. They will have more back pain, spine pain, body pain, and stiffness at night. They toss and turn all night. Is the pain waking them up? Those kind of questions I'm going to ask. Also, caffeine intake. Do they eat late at night and have heartburn? Or do they drink coffee all day? Or they're so tired all day long, they have to drink the energy drinks, which are terrible for our health. Analyzing why they don't sleep. Now, I look at women who are perimenopausal. One of the first symptoms of perimenopause is poor sleep. They wake up, not even with hot flashes, just wake up at 3, 4 o'clock in the morning. I see a lot of women who are in their 40s and go through perimenopause. So they will have musculoskeletal pain of menopause, which is achiness and stiffness. They may have joint pain in the shoulders. They may have irritability with mood. They may not even have hot flashes that will say, oh, I'm in perimenopause, until maybe a few years later. And for many, sleep is the first thing that goes. So addressing sleep from that point is essential. Doesn't matter how many sleep cycles you're going to have. If your issue is hormones, they may not help you all the way. You may have some benefit to it, but it's not going to be the solution that you're looking for. I also see patients who have incredible stress level. And in general, I think sleep is a canary in the coal mine. It's the first thing that goes under stress. So if somebody is a teenager and they have a lot of stress at school, at home, the first symptom may be poor sleep quality or tossing and turning or not getting restful sleep. Sleep is a very complex problem. And so I usually address it with every patient, and very few patients have good sleep quality.
When you do see someone change their sleep around, let's say, and go from having poor sleep to getting good sleep, and they see improvement in their symptoms, is that usually an actual improvement in inflammation? Is the body actually having more time to truly heal itself at night? Or do you feel like it is more because it helps your central nervous system that your processing of pain and being able to handle pain is better because of more sleep? Or is it both?
It's a bit complicated one. Of course, we need good night's sleep to both heal and control inflammation. Sleep significantly impacts inflammation and healing by changing how our immune system works. lowering harmful inflammatory markers and helping our body repair itself. During deep sleep, our bodies release growth hormones, special chemicals that help fix damaged tissues and cells. This is also when our brain cleaning system called the lymphatic system gets to work. This system is like a washing machine for our brain so that it removes waste and toxins while we sleep. It's an ingenious process. So the spaces between brain cells actually get bigger during sleep, allowing fluid to flow through and wash away harmful substances that can cause inflammation. It is similar to the lymphatic system per se, but it's for the brain. We need more than 7 hours of sleep for this system to work more efficiently. Studies show that poor sleep can actually slow down wound healing by up to 60%. I find this just amazing. And this is why doctors now recognize that good sleep is just as important as healthy eating and exercising to control both inflammation and promoting the healing. And practically, we know that when we don't feel good, like we have the flu, we need to have good rest to recover. And if we have a significant illness, once it passes, sleep actually helps us to recover from it completely and fully. Nothing like a good night's sleep to finish that healing process.
You were alluding a little bit to this, talking about sleep, but stress is a big trigger for autoimmune condition flares. And how do you go about helping patients manage stress? Because I feel like there's so few tools out there for patients actually managing stress, because we can't make stress go away.
Definitely is a major trigger for autoimmune condition flares. When our bodies feel stressed, we release chemicals like stress hormones that can throw our immune system out of balance and make symptoms like pain worse. Negative emotions, stress, and chronic pain actually are located in an area of the brain that shares boundaries. I like to start by acknowledging that stress is a normal part of our lives. We can't make stress disappear. We can't make traffic go away or rude people in the grocery store disappear, but we can change how we respond to it. First, I teach my patients mindfulness practices to just recognize the stress signals, like noticing maybe when your shoulders are more tense, or maybe your sleep gets more disturbed. Our sleep usually gets worse when we're under more stress. And again, noticing it without judgment. Maybe we become more anxious. Maybe we start thinking more about not doing things or avoiding things. Whereas humans have habitual patterns. So knowing patterns and what we do under stress is helpful. For immediate relief, deep breathing or grounding techniques are easy to use, and we can use them at any time. You can Google it or YouTube it, multiple ways of doing deep breathing relaxation. There's many ways of doing it. Very simple, easy to learn, accessible, free, and actually works really well as a stress mitigation. In just 5 minutes of slow, focused breathing can activate the calming part of our nervous system and relax us. Spending time in nature, going for a walk when we feel stressed out, just being connected to nature, looking at the trees, stepping on grass, hearing the sounds of nature, looking at running water, if it's a creek or some sort of body of water. We know that just 20 minutes in nature significantly lowers the levels of stress hormones. I also introduce my patients to Yoga Nidra. It's a guided relaxation practice where you lie comfortably while following voice instructions, similar to body scan. It's like a shortcut to deep relaxation that many patients find more accessible than simple traditional meditation. It's easy to use. You can find many recordings on YouTube or by Googling on Insight Timer app or other meditation apps. Patients find it easy to use, and you can do different lengths of time, like 5 minutes, 20 minutes, half an hour, 40 minutes, depending on how much time you have. And it's very helpful. Another thing that we sometimes forget about stress management is how to set boundaries. So boundaries are absolutely essential for stress management, especially for autoimmune disease patients and women in particular. Women tend to be more caregivers, and we see that caregiving and autoimmune conditions actually go hand in hand. We as women tend to put ourselves last often, and it has consequences for both our health and stress. identifying toxic relationships or situations that drain our energy and practicing saying no. No is a complete sentence. It helps to mitigate the stress indirectly. When we do less, sometimes we have more time for self-care. Sometimes this means limiting time with certain people or completely removing yourself from toxic environments or situations or company of people that really trigger your flares. And for long-term management, I try to help patients practice attunement, the ability to tune into both their own needs and also meaningfully connect with supportive people around them. This social connection actually changes our stress biology in positive ways. The key is finding what works for each person and making these practices part of daily life, not just something we do when stress becomes overwhelming. Yes, if we have too much stress, even a small practice can make a difference, but small, consistent steps make the biggest difference in managing stress and reducing autoimmune flares over time. It's like keeping the cup not filled to the rim all the time. So the stress happens and it overflows it. Keeping the cup empty so you can actually have some resources to mitigate stress when you're under stress. That's what the goal is of stress-reducing practices.
We have your podcast that, again, is called Mind Your Fibro, that would be helpful for people to listen to get more information on these things. She has lots of episodes about nutrition and stress management and actually to just taking care of yourself in general. Are there other resources out there that you recommend, particularly for people with autoimmune conditions and fibromyalgia?
Thank you for mentioning my podcast. For people with autoimmune conditions and fibromyalgia looking for helpful resources beyond my Mind Your Fibro podcast, I recommend a few trusted sources that provide evidence-based information without overwhelm. So the American College of Rheumatology Patient Resource Center offers reliable information explaining conditions in a simple to understand plain language. The Arthritis Foundation website has excellent how-to guides for implementing practical lifestyle changes, not just what to do, but how to actually make these changes stick in your daily life. For nutrition, specifically, the Anti-Inflammatory Diet book by the Andrew Weil provides straightforward guidance without extreme restrictions, focusing more on Mediterranean and plant-based eating that includes healthy animal protein as well. American College of Lifestyle Medicine focuses more on a plant-based eating. It depends on the patient and what the patient wants or needs, but the resources are readily available. I also like the free resources from the Academy of Nutrition and TEDx that focus on practical meal planning. For stress management, the free Insight Timer app is excellent. It has specific guided meditations for chronic pain, autoimmune conditions, including some short and longer sessions for yoga nidra, as well as deep breathing and grounding. The key with any resource is to avoid getting stuck in research mode. You can spend hours researching and Googling health information, but knowledge alone doesn't improve our health. It is consistent implementation of lifestyle changes that actually make the difference. Many patients get caught up in what I call the research trap, endlessly searching for the perfect diet or perfect exercise routine or supplement regimen, listening to podcasts, listening to audiobooks, going to lectures, spending hours on social media and watching their reels while postponing the simple actions that would actually help them feel better. We need to start. Without doing, there's going to be no outcome. There's going to be no improvement. The truth is most people already know the basics of what they need to do. Move more, eat more wholesome foods, manage stress, and improve sleep. The challenge isn't knowledge. It's consistent action. Even imperfect changes applied consistently will outperform perfect changes that never get implemented or only last a week. So 1% change, tiny habits accumulating over time. It's that 1% that will make the difference if that 1% is applied day in, day out. We need to focus on small changes that you can implement and you can maintain. This is why I focus on helping my patients identify one small, sustainable habit they can start rather than overhauling their entire plan or entire system. maybe walking for 10 minutes after dinner, or adding one vegetable to lunch every day, gradually increasing water intake so it doesn't feel like a rain after a drought. These modest changes might not seem impressive when we read about them online, but they create a foundation of success that you can build upon later. So remember, your body responds to what you actually do, not what you know or plan to do someday. The simplest changes you implement consistently will always be more powerful than elaborate plans that remain only as a browser bookmark or saved article or saved podcast. So I hope that you take the message from today's podcast is just start. Just do something little every day. Don't make it perfect. Make mistakes, pivot, change, be flexible, implementing those new changes, not just pondering about them and thinking about them. It's a good reminder that it's not what you know, but what you actually do regularly that makes the difference in managing these chronic conditions.
I think one of the things I'm noticing of doing this show with you is actually doing a show with someone else who is lifestyle medicine trained. You can see so many similarities in some of the messages that Kitty and I are saying on the show on a regular basis, and being able to have another physician on here who is also lifestyle medicine trained and passionate about that and how you approach patients. I'm just over here like glowing. I'm just smiling because everything you're saying are many of the messages that we are also talking about, maybe not specific to autoimmune conditions or rheumatological conditions, but we're just talking about for our overall health, but it all applies. And I think that's the big message that I would love for everyone to hear today is regardless of what you may be dealing with, these basics are going to be important to help your body heal.
And how could someone come see you and hear more about this?
So at my whole health rheumatology practice, I combine conventional, traditional rheumatology treatments that we usually employ in rheumatology, such as DMARD medications like methotrexate, biologics, all the medications, infusions, injections we offer. But I also combine it with evidence-based integrative approaches to create a more comprehensive care model for my patients with autoimmune and inflammatory diseases. I don't just focus on suppressing inflammation with medications, although I certainly use those medications when appropriate, and I think they're life-saving. But I also look at all the factors that might be influencing your condition, including diet, physical activity, stress, sleep quality, environmental exposures, gut microbiome, hormones if you're in perimenopause or menopause, for example, and even your social connections and your sense of purpose. Our appointments will be longer than in a typical traditional rheumatology practice. I want to know a lot about your background, your stressors, how you grew up. Longer appointments allow me time to discuss lifestyle factors alongside with medication management. My whole health approach also means working collaboratively with other specialists that you may need. It may be neurology or orthopedics. I refer to physical therapy, psychologists, psychiatrists, but I choose those specialists who actually understand autoimmune conditions and work well with this population. I want to coordinate care experience, not just send referrals. Patients with autoimmune conditions are often traumatized by not having coordinated care or getting a delay in diagnosis, or not having time to express what they feel and don't feel supported often because of the rushed appointments in a typical healthcare setting. So my goal is to help my patients build a personalized plan to manage their condition that addresses root cause wherever possible, not just symptoms. This approach recognizes that while medications are often necessary and very often life-saving, they work better when complemented by evidence-based lifestyle modifications that support our body's natural healing mechanisms. And hopefully you can get into remission and get off medications if possible. That's my goal. My goal is for patients not to be my patients for the rest of their lives, but actually get better and hopefully move on. It's not always possible, but it should be a joint goal. Many patients come to see me when they lost all hope in getting the diagnosis. They may have some non-specific complaints like fatigue or achiness, some abnormal labs, but they may feel dismissed, or they go from doctor to doctor not getting the diagnosis. There are so many good doctors in our community, and I know so many of them. Unfortunately, the time allowed to spend with patients are often dictated by our healthcare system or the insurance. It's not fair to any physician to be in this kind of setting, but it is what it is. So after I left my employed practice, I decided to opt out of all insurance plans to have flexibility to treat patients how I want to treat them and not to be dictated by the insurance or healthcare system of how many patients to see and how long the appointments should be and what kind of conditions I can see. I want to have time with patients, but I also want to have cost transparency. My patients are often surprised how much more efficient and cost effective their healthcare can be when it's between our office and them. Once they see the cost and when they remove the insurance company and the large healthcare organizations that add fees and increase prices on everything done, from x-rays, labs to facility fees, my patients pay me directly for their visit, and I utilize direct care model, and most still use their insurance for labs and imaging services and medications, etc. But even with labs, imaging, and medications, we'll look at other alternatives where they can get them done. For example, a hospital x-ray may cost them over $300 per x-ray, and that's with insurance, so that you factor in deductible, versus standalone imaging center, it may be $45 to $60 per x-ray. Heart ultrasound or 2D echo, $4,500 in a hospital due to facility fees. Now it's a hospital procedure that used to be outpatient procedure versus $450 in a small private cardiology office, direct price, and even less if they use insurance. I think my patient paid $160 or something like that for an echo that a large organization was quoting them over $4,000. There's no price transparency with insurance and healthcare organizations. Everything is marked up, and many patients are not aware of the significant price markup they pay just to be treated at a location, such as hospital-based medical practices that add on a facility fee and charge you for labs and x-rays like you went to a hospital, or using commercial pharmacies versus small direct-to-consumer pharmacies where the same medication may be purchased without the insurance at a fraction of a cost. I have patients who pay less for a 90-day supply of medication directly cash, self-pay, versus a copay that will cost them more for 30-day supply. The markup is significant, so we are working with each patient to find the best affordable price for the medications, for imaging, for labs. I can do them in my office, or we can send them to other labs, but I want them to get the best care they can because they are already spending hundreds of dollars per month on health insurance. And yes, they work for it, they need to have it, they use it because many of them have extremely expensive medications, biologics and whatnot, but the healthcare has to deliver the quality for the price you're paying. So I'm trying to make the best affordable care they can get and provide with the time and support they need. And I know this is probably our last question, so I want to thank both of you for inviting me to this podcast. This is my first ever interview on any kind of podcast, so I really appreciate the time you gave me. As you can tell, I'm very passionate about lifestyle medicine, integrative medicine. I want patients to know that rheumatology is complex and it's really interesting area of medicine, and their needs are important, but everything we do in medicine has to be augmented by what we do at home. Things that we use at home for lifestyle, sleep, stress reduction, working in nature, talking to loved ones, holding hands, eating good food, listening to music. It makes a difference about how we heal. And I really appreciate you having this platform, this podcast, to really spread the message in Kentucky and hopefully beyond Kentucky on lifestyle medicine and the impact of it on our general health, not just rheumatology health. I appreciate it.
This has been incredibly helpful, and I think you're really just able to get a great point across that is something that we try to get across as well, is that you don't have to be perfect with things, that you just need to get started. First, just recognizing if you do feel like you're having pain or swelling or stiffness, and especially if it's something where movement helps as opposed to movement making it worse, that might be a time that you want to talk to your primary care doctor and potentially do some more investigating. But it's not just one thing. It's not just symptoms. It's not just labs. It's the whole picture together, and so really having someone that can listen and look at your symptoms, look at your physical exam, look at your labs, and put everything together instead of just one thing, that's really the best way to approach if you feel like you might have one of these conditions we've been talking about today. And then I really can't say it any better than you already have, in that there are lots of medications and treatments that we have to help with these things, but they only help a certain amount. So you want to get what you can from that if you need those treatments, but also not forget that food is your treatment, sleep is your treatment, movement is your treatment, having social connection and happiness is your treatment. And so make sure you don't just do one thing. Try to do some of all of it, even if it's just one little tiny step in each of those directions at a time. We really appreciate you talking with us today. I think you had a lot of great advice, and we may have to try to snag you back on the show for some more specific things as well. So if you have any questions about any specific rheumatologic issues, please send us a text or email us at contact@thestartinggatepodcast.com, and we'd love to hear from you, and we can go into more detail on any of these if we need to.
And that will wrap up our musculoskeletal segments here on the Starting Gate podcast. But we hope you've enjoyed this group of shows. And again, any ideas, we always love to hear them. So let us know. And I hope you have a great week.
See you next time.